One of the most common birth defects in the world can make it challenging for a person to eat, speak, and even breathe. But this NGO hopes to make it easy for those with a cleft lip and palate to have access to healthcare. Let's learn more about Operation Smile Philippines from their Executive Director, Emiliano Romano. Thank you so much for joining us, Emiliano. What is cleft and why should it be treated?
All right, thank you, Rico. Well, cleft, it's they've done so many research about it, but unfortunately they really haven't pinpointed what could be the cause. But the prevalence there is malnourishment, especially from the mother before even giving birth. So I would say that the nutrition component actually of giving birth and everything, that could be one of the #1 prevalence for this.
But when must a child be operated for this cleft problem?
Unfortunately, cleft, it's not a priority. But if you're asking me, I would put a priority. Why? By having a cleft, intaking of food will be very difficult for the child. Right. And because of that, the child become malnourished. And there are cases in the past, around the world that, of course, how many children died because of being malnourished, right? Second to that, it's actually changing a life of a child. When you say changing a life, you're giving a smile, you're giving them a new life, right?
But Emiliano, at which particular age is the right time for a child to be operated for either their cleft lip and palate?
So for Operation Smile Philippines, cleft lip is at 6 months minimum, and then cleft palate is 1 year old.
1 year old?
Yeah, so as much as possible, we want to keep that. But of course, we have many patients that goes 2 years, 3 years old, 4 years old, and the like.
Yeah. And how many cleft lip and palate operations does Operation Smile conduct on an annual basis?
So on an annual basis, we try to give about 800 to 1,000 surgery, give or take. So far until to date, from the time that we started, which was 40 years ago, we have
Happy anniversary.
Thank you. We have done already about 33,000 surgery here in the Philippines alone.
33,000 surgeries, but is there a backlog? How many more haven't been yet operated on because of their cleft issues?
There is a lot. So think about, in the Philippines, the prevalence is 1 is to 500 newborn is born with cleft lip and palate. So if you look about the worldwide number of cleft, we have about an estimate of 5 million backlog in the world.
What about here in the Philippines?
In the Philippines, I would say, give or take, is about 200,000. I would say a simple backlog that we have numbers. We're not considering those who were born in communities that unfortunately they do not record or register with us.
How do you provide your services and facilities? Because there are many children across the archipelago who have this cleft lip and palate problem. Do you go to them or do they come to you?
So usually it's both ways. So as much as possible, we have many partners in communities around the Philippines that goes into the grassroots of communities and try to recruit. We partner a lot with the LGUs as well. Like for example, we are partnered with the PNP of Region 2 and 3. What they do, they go into communities and register patients from us and actually pick them up from their home and bring them to our center to receive our care.
But also to be able to address and help more children with this backlog number that you just have told me, this enormous. Operation Smile Philippines has to really ramp up.
Correct.
Support, collaboration, sponsorships from many organizations and the private sector.
Definitely. At the end of the day, we're still an NGO. We are a non-profit, right? So the more supports we get from private sector, from corporation or foundations, the more patients we can take care of at the end of the day. So,
what are your goals for 2022? Right now, you've already helped 700 kids. Will you be able to attain your 800 to 1,000 or even go beyond that and help more children who have the cleft issues?
Definitely, that's our goal, yes. Nothing stops us to deliver our numbers. Of course, the more supports we get from private sector, the more we will be able to recover and provide care to even more. Because for Operation Smile, aside surgery, we do a complete comprehensive care, which is not just surgery. We provide nutrition, speech therapy, dental, psychosocial
It's a total
care.
package.
It's a total package, that's right, for all our patients.
And where does Operation Smile go? I mean, which provinces have you already been able to serve here in the Philippines?
In the Philippines, we're probably almost all, I wouldn't say all, but almost all. However, we have presence in Manila. We have one of our centers. We have a center in Pampanga as well, and in Davao. Currently, right now, we're very happy. We actually have a medical mission happening, or a surgical program happening in Cebu.
Which is an all-female
Female, that's
team,
right.
right?
It's, all
How
female.
significant is this, Emiliano?
So all-female team, the reason we decided, so this is a global initiative and we thought to do it here in the Philippines because...
So it's not just a purely Filipino team, and it's
No,
an
it's a mix.
international
It's
surgical and educational mission.
That's right. It's really to empower the next generation of women into the surgical atmosphere. So that's why we had many volunteers coming from all over the world here in the Philippines. We had the first day, which was about training and lecture, understand the landscape of every specialty. And then now, right now, tomorrow I think is our last day. This is where we're doing 3 days of surgery. Our aim is to be able to deliver about 50 to 60 surgeries, at least in these 2 to 3 days.
And usually, how long does the operation take and the recovery period?
So a surgery per se takes about, I would say, 45 to an hour, depending of the team, depending how complicated is it, just a simple cleft lip, is a bilateral, is a cleft lip and palate. And then usually a fully healed after surgery takes about 30 days. What we are good, I think, in Operation Smile is we make sure that we do post-operative care. Wherever we go, we come back, usually after a week, we check the sutures, we check how the child is, and then we make sure that we assist the child until they're completely healed from the sutures and the cut.
Will Operation Smile Philippines have more of these international surgical and medical missions?
That's right.
Going forward?
Well, for now, right now it's our 40th anniversary. So this year, so there is a lot. We are actually next month, which is in November, we have a medical surgical program in Bacolod, as well in Palawan. And then, of course, we are building up to our 40th anniversary in December to be able to, our goal we are doing right now is to build a multi-comprehensive cleft care in Cebu, which this center will be able to provide. The goal is to provide 10,000 surgery at least in the next 3 to 4 years. One center alone.
Right.
So we are putting 6 operating rooms and all specialty. And the idea is to become actually a training center for medical practitioners all over the world to come in, be trained about cleft, be trained about nutrition, speech, dental, and then goes back in their country or in their hospital and share the knowledge.
So when will this center in Cebu finish, and when will it start when will it be operational?
So we are starting, the groundbreaking will be December this year. And then we are aiming about a 6 months period. So we are aiming that hopefully by July next year, we'll be able to treat the first patient in the center.
Wow, that's a great boost. 10,000 operations.
In 3 years.
In 3 years. So that's an average of about 3,300 a year,
Correct.
which will also triple your total on an annual basis.
That's right. That's the goal.
Congratulations and all the best to Operation Smile Philippines.
Thank you so much, Rico.
Thank you so much for joining us. The Executive Director, Emiliano Romano.